Welcome back. This Mother's Day, a common ground conversation on the maternal health crisis in America with two governors of different parties, Republican Sarah Huckabee Sanders of Arkansas and Democrat Wes Moore of Maryland, along with philanthropist Olivia Walton, founder of Healthy Moms, Healthy Babies America. Olivia, I want to start with you because you lead organizations that focus on the health of mothers and children. So I want you to really set the stage for us. Some of the statistics are staggering. In the United States, the reported maternal death rate has doubled in just the last 20 years. The CDC says 80% of these deaths are preventable. What more can be done to prevent these deaths? How do we as a society come together to achieve that?
It is shocking, but the good news is we really do know how to fix it. As you said, the CDC consistently finds that over 80% of these deaths could have been prevented if these mothers could have gotten care. So what we're launching is Healthy Moms, Healthy Babies America. We are a nonpartisan national campaign uniting a broad coalition of business leaders, of faith leaders, of employers, of policymakers, and healthcare providers with one clear goal, which is to cut the U.S. maternal mortality rate in half in 5 years. It sounds audacious, but I'm confident in large part thanks to the incredible leadership here at this table that we really can get this done.
Governor Moore and Governor Sanders, I want to bring you both in. You've both worked on this issue. You've enhanced funding to maternal health, which has led to more access to doulas, healthcare, ultrasounds, for example. Governor Sanders, what is the hardest part about making progress in this area, and what more needs to be done?
I think one of the hardest parts for us is that Arkansas has consistently ranked at the bottom. And so bringing about the kind of change and awareness that is needed is a heavy lift. We started Healthy Moms, Healthy Babies Arkansas, and we have put $45 million towards addressing maternal health in our state. We have about 35,000 pregnancies in Arkansas every year. 10,000 of those women are not seeing a doctor until after their first trimester, and over 1,100 never see a doctor until they go into labor. We're already seeing the positive impact by raising that awareness and opening up a lot of access. We have 75 counties in Arkansas. Every single county has a Arkansas health unit, and we've started an ad campaign where all women can go and receive services there for free in order to help change the trajectory of our state.
Governor Moore, how do you see this issue, and what do you see as the biggest challenges?
You know, I think I really want to both thank and congratulate the work that's happening. And also what it does, it highlights the reality that oftentimes these discrepancies, they are generational, they are concentrated, and oftentimes intentional. And so the way we have to address it has to be just as intentional in addressing it in the way that these problems have been created. And it has to be bipartisan, and it has to be something that brings in other sectors. And in fact, we're just now announcing that something called the Bridge Project, where it is something that's going to focus on and providing cash assistance to mothers who are both prenatal and then postnatal mothers, to be able to provide cash assistance for them, to be able to have additional measurements of support. It's going to happen for 150 families in the most areas of Maryland that you've had concentrated poverty being a long-term challenge.
Yeah, and that takes me to the next section of this conversation. We have to talk about Black maternal health, Black women in the United States. Olivia, again, I mean, you talk about the statistics. They're 3 times more likely to die from pregnancy-related causes than white women. This impacts Republicans, it impacts Democrats, it impacts non-voters, independents, everyone. What solutions do you think exist to address this crisis in Black maternal health?
Well, a lot of it is about visibility. So first of all, awareness of the problem is lowest where outcomes are the worst. So talking about it, having leaders of color actually going out there, leaders who have proximity to these issues, getting on board goes a long way.
Governor Moore, what are you doing to address this staggering surge in Black maternal deaths due to pregnancy?
I mean, and then this is also, it's a very personal issue, you know, for us, where, you know, I watched my father die in front of me when I was 3 years old because he didn't get the health care that he needed. You know, we know that this is both about how are we, really focusing on bias training, understanding that when people are coming in with specific needs, that there is an implicit bias that oftentimes does happen. And so we need to make sure that our physicians and our nurses are trained up. But also what we've got to do is we've got to strengthen the pipeline to get more physicians and nurses of color who are actually in there, to increase the probability that when a person comes in, they're going to have someone who's going to be treating them and supporting them who looks like them, who represents them. And so we do think that type of training and those type of pipelines are crucial in this conversation about being able to deal with the Black maternal health challenge that we have within this country.
Governor Sanders, how do you see it?
I think one of the points Olivia made was the coverage of doulas and community workers and having somebody that helps support throughout the process. That's been one of the things that we opened up coverage for. But I think one of the big pieces that so often gets left out of the conversation, especially when it comes to government, is the faith community. And this is a place where there is an implied trust and there's a relationship that already exists.
Well, I do want to talk about the fact that for all of you, this is personal, because as you've all alluded to, you are all parents. This is an issue you all care very deeply about. And I'm just curious how that experience of being parents has changed, has impacted how you see maternal health. Governor Sanders, why don't you start it off?
Certainly being a mom, I think, influences everything I do. I firmly believe I'm a better governor because I'm a parent. Every decision I make, I know will have a direct impact on the life of my kids, as well as every kid growing up in my state. That's not something I take lightly. And I am living a lot of the decisions, as are you. I mean, we were talking just before, our kids are the same age. So when we're, working on getting phones out of the classrooms, we're fighting that at home too. When we're working on, trying to do certain things, we're living that in real time.
Governor Moore, how has being a dad impacted how you see this critical issue of maternal health?
Being a dad has impacted everything about my life. It's given a sense of perspective. But, it's especially when it comes to maternal health, it's also reminding me of the importance of making sure that we have representative voices in there. Mm-hmm. I think about it in context of my own mom, right, who's an immigrant single mom, who is an angel. There are also just certain nuances of being a man that she couldn't teach me. Mm-hmm. Because she didn't know it, right? So I had to learn it from other people. I think the same thing with my daughter, who I love with all of my heart, my 14-year-old daughter. And there is nothing that I won't do for her. I also know that there's certain nuances of being a woman that I can't teach her. And that's part of the takeaway from the policymaking conversation, where there is so much that we can do, but if we're not making sure that impacted communities aren't just the subject of the conversation, but are actively part of the conversation, we're going to miss things.
Olivia, I'm going to give you the final word. How has being a mom impacted and informed your passion for addressing this issue of maternal health?
So our kids are 8, 5, and 3. I'm thrilled to say we're sleeping through the night now. It's a little more fresh, and I have so much privilege, right? I am healthy. Thank goodness. I have resources, I have family, and it was still so hard. But just seeing how much help I needed when I had all that privilege was just a rude awakening in how hard this is for millions of Americans who we really count on to raise the next generation of Americans.
And our thanks to them for that incredible conversation. You can watch my full Common Ground conversation with Governor Sanders, Governor Moore, and Olivia Walton at meetthepress.com.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.